So this is Jayant Sharma. I'm assistant professor in Equity department. So today I'm going to start hypersensitivity on the phone. And rest three I have discussed already. So if you have not gone through the video, please you have to. So today I'm discussing about the hypersensitivity on the phone. This is very crucial for the exam purposes also. So our immune system or immune plays a very important role or very significant role in protecting our body against pathogens or antigens or foreign particles. But sometimes there is exaggerated responses. So these exaggerated response is triggered by the interaction of the immune system with an antigen, and it is referred to as hypersensitivity reactions. Hypersensitivity reactions are classified into four types by Combs and J. So first three are considered immediate hypersensitivity reactions because they occur within the 24 hours of the introduction of antigen or foreign particle. And the fourth type is considered a delayed hypersensitivity reaction because it is usually occur more than 12 hours after exposure to the allergen with a maximal reaction time is 48 to 72 hours. It can extend also. So the four types of hypersensitivity reaction we have discussed the three, and today I'm starting the number four. So a type 4 reaction mediated by the T cell. So it is also different like S3 were the antibody mediated, and type 4 is the cell mediated that provoke inflammatory reactions against exogenous or endogenous antigens. In certain situations, other cells such as monocyte, eosinophil, neutrophil can be involved. So after antigen exposure, an initial local immune and inflammatory response occurs that attract leukocytes. The antigen engulfed by the macrophage and monocytes is presented to the T cells, which then become sensitized and activated. So these cells then release cytokines and chemokines, which can cause tissue damage by and may result in the illness. So examples of the illness resulting from the type 4 hypersensitivity reaction include contact dermatitis, it is a skin inflammation, drug hypersensitivity type, and type 4 reactions are further subdivided into type 4A, type 4B, and type 4C, and type 4D as well, based on the type of T cell. CD3 helper cell type 1 and type 2 involve the cytokines and chemokines produced. So the etiology is the hypersensitivity reaction number 4 are to some extent normal physiological event with the help fight infections, and dysfunction in this system can predispose to the multiple opportunistic infection also. So adverse events can occur due to these reactions when an undesirable interaction between immune system and allergen happens. So exposure to the poison resulting in contact dermatitis is classical example. So several drugs, antibiotics, anticonvulsants can trigger hypersensitivity reaction number 4, leading to the drug hypersensitivity and other clinical syndromes. So epidemiology is like type 4 hypersensitivity is common disorders among susceptible individuals. For example, prevalence of the contact hypersensitivity is around 1 to 6% among the population of the world. So another minor subtype of type 4 hypersensitivity reaction is called drug allergy. So the drug allergy is sometimes considered a distinct disease and constitutes around 1/7 of the side effect of drug. And 2 to 3% of hospitalized patients show allergic reaction on their skin in Western Europe and Asia. And epidemiological research shows the relationship between atopy in healthy people and purified protein derivatives. So a large cross-sectional study done in the Sweden shows the PPD reactions of more than 3%, 3 millimeter, which is somewhat more frequent in patients with the atopy and the normal population around the 15.1% versus 14.7%. So however, PPD response it is a like active material of the tubercular bacilli. So with the result of more than 10 millimeter were found to be 1.4% in normal children versus the 1.2% in the allergic population as well. So complications are so granulomatous disease can affect any organ in the body, but for each type of granulomatous disease, there are common organs that are usually affected. For instance, sarcoidosis disease usually affects the lungs, eyes, and kidneys, so resulting in the pneumonia, lung fibrosis, pulmonary failure, cataracts, glaucoma, kidney failure also. In addition to the lungs, tuberculosis usually affect the vertebra and the joints, resulting in the back pain, joint stiffness, and the arthritis also. In contact dermatitis, examination can occur, which is a systematic failure of the skin inflammation after the second exposure to a specific allergen. So skin inflammation disrupts the normal skin, which is the most significant barrier in our body. So disruption of the skin result in the increased risk of the secondary infection for the patients because of the skin invasion by the bacteria and the other infection organisms. So severe Steven-Johnson syndrome, toxic epidermal necrolysis can result in the permanent skin scarring. So differential diagnosis like viral exanthems and the certain bacterial infection can present various maculopapular on skin that can appear similar to the contact dermatitis, and the exposure to allergen and the temporal relationship to the offending agent can help the differentiate these conditions. So sarcoidosis can present with the pulmonary symptoms, and the chest X-ray can reveal the hilar lymphadenopathy. So this is the presentation. Sometimes can be similar to the tuberculosis also. So however, the treatment is completely different. Antibiotics are prescribed in tuberculosis, which steroid therapy is needed in the sarcoidosis. So prognosis like depend on the manifested clinical conditions. Most contact dermatitis resolve within the general nodes. Sequel studies show up to the 40% of the patient who over the allergen had not experienced any dermatitis. So new acute cases more common among white and blacks, with the high chances of a spontaneous remission within 2 years. So topic is over. So if you have any problem, let me know. Thank you so much. Namaste. See you in next class.